All right, guys, welcome to Healthy Living Global. I remain Health Educator Mike. All right, who is joining us? Who is joining us in this live streaming? Yeah. Please share to your contacts. There is no time. Share to your contacts. Let them come and join this live. So sorry, we are beginning a bit late. Just like we said, what we are discussing today is blood cancer. Okay, so blood cancer. That's our discussion today. Different aspects. So, what's the blood cancer? In fact, even how the body are being deteriorated by the blood as soon as possible, right? Now, we can ask ourselves, what is blood cancer, right? Blood cancer is actually, we know what cancer is all about. And we know that, at least with our little experience, if I say, let me ask you now, what is cancer? You can be bold enough to tell me that is the production of abnormal cell, right? So let's just leave it that way, layman's understanding. Now, we say, what is blood cancer? Blood cancer is that abnormality of the cell that affects the bone marrow, the blood, and even the lymphatic system, right? So that's just a simple definition of blood cancer. Now, and you need to understand that this blood cancer have three different types. Okay, so there's one we call leukemia. Another one is lymphoma. Then the third one is myeloma. But in this life, we are focusing on leukemia, strictly on leukemia. I've actually prepared something and a note that's jotted one or two things down, which I want to be a kind of following one after the other to teach us one or two things about this about the blood cancer. Sorry. Now, you can ask me, or in your mind, I believe by now you must have heard of this blood cancer and probably must have heard of leukemia, right? See, what is leukemia? I used to read sometimes. I see a word like that. Yeah, you need to know the meaning. Please, let me say this. Please share this to platforms, share this to different groups, right? Both Facebook, can share it to anywhere, right? So that people will join. This particular platform here, Healthy Living Global, is a platform where we train health personnel and also other people that wish to learn, because sometimes you can be with your healthcare provider, they'll be doing some practices of which you don't understand, right? You need to understand with them, and you cannot understand if you did not pay attention to some health teachings or health tips. So you need to have your own idea so that whenever anybody is doing the wrong care for you, you can be able to say, no, please sir, or please ma'am, please nurse, please doc, can we do it this way? At least you will have a say. So this Healthy Living Global, it have a global goal, right? so that we bring health personnel together, train them, so that anyone who is standing as a Healthy Living Global family doctor, nurse, psychiatric, nutritionist, dietitian, pharmacist, in fact, as long as Healthy Living Global is attached to you, you're supposed to meet up to the standard of care you are giving to your community. So please, those who are with us, let us try and get educated so that we can know more concerning our practices, then know how we attend to patients. The goal is that everyone will live a healthier life. The lifespan of people will be extended. So please, let us see how we go about this global goal. So it's something we need to do together to achieve our aim. So both as a healthcare personnel and also as just a follower or a subscriber. So I believe you have a lot to learn, share to others so that people will stay informed. So today now we are discussing about cancer, blood cancer, right? So you can say this cancer, in fact, you are hearing it, right? It's not that common. You are just hearing it. It's very far from you. Because you say, okay, what is this blood cancer all about? Which people are always getting it? Maybe you mistakenly go and ask Google or Phoenix. They will tell you is those above 65 years, is common in men, is common among the whites, right? That's what it is going to tell you. But let's come to the reality of it, right? We are the people that normally take all those information, try to get all those information from co-health care providers, all right? The hematologist, right? So we try as much as possible to get this information. I'm not a hematologist, I am a health educator. So I stand to be corrected by a hematologist, but whatever I'm telling you here is real, right? So let us understand this. So we need to learn. Okay, now today we said we want to discuss about leukemia. Let's leave the remaining two of type of blood cancer. So we want to talk about leukemia. So what is leukemia? Leukemia is actually the mutation of the blood cell. During the formation of blood cell, right, we call it hematopoietic stem cell, right? That the formation of blood cell from the stem cell. So during that period, a single cell can mutate, means change its form, right? Maybe there's a problem with how DNA gave it the instruction to a kind of change. And I believe you know that DNA controls the activities of the cell. So when there's a little change, of which as it stands now, scientists have tried to investigate what actually causes this change, which is mutation. The cause is unknown. So it's believed that it happens spontaneously, right? So nobody knows the cause. So during this mutation, the mutated cell, right, will begin to grow uncontrollably, and it's no longer like the normal cell, right? It's no longer like the normal cell. It doesn't have any function. It's not playing any role to the body. So they are normally white blood cell. Okay, let me start it in this way, all right? How cell is being formed from the stem cell, right? So now, from the stem cell, some cells are being developed into myeloid cells, while some are developed into lymphoid cells. Okay, so these myeloid cells will now grow and mature, which is, we're talking about a good cell now, will now grow and mature and become the red blood cell, blood platelets, and some of the white blood cells, such as the basophils, the eosinophils, and the neutrophils, right? That's what the myeloid cells are going to mature into. And we know the function of the red blood cell carries oxygen and other vital materials to the body so that the body will keep doing its activities as expected. We know what the blood platelets is doing. It helps in blood clotting. We know what the white blood cell, because it forms also some white blood cells, right? So we know what the white blood cells are doing. They fight infection. So myeloid cells, they kind of mature to produce all those cells. Then another part is the lymphoid cells. So the lymphoid cell mature to produce the natural killer cell and the lymphocyte. All right. So it matures well to produce natural killer cell and the lymphocyte. That is for the good cell. But now, this leukemia cell, in an attempt to form, it's always an immature white blood cells, right? So it will be making attempt to develop into that particular cell, good cell, but cannot work because there is a mutation in the cell, right? There is a change in the DNA of the cell. So there is nothing of which it can do. It keep fighting, that's why it's multiplying uncontrollably, right? And we need to know that this blood cancer, where it is somehow dangerous, is that it doesn't have a mass, right? Like a tumor, of which is okay during surgical procedure. They now a kind of remove the tumor, right? It's in the blood. So how can you remove it? The only way, just stem cell transplant, right? So sometimes it's always difficult during the treatment. So in this leukemia, just like as I was explaining, I said it results from this mutation of the cell. So in the bone marrow, all happen in the bone marrow. So when that change occurs, it begins to produce this cell that it kind of divide and produce itself uncontrollably. And what will it do? It will go and outnumber other good cells that are functional. The leukemia cell might not be harmful to the body, right? But it will take the space of the good cells that are functioning. And we know the functions of cell. I've mentioned white blood cell, I've mentioned red blood cell, I've mentioned the blood platelets, they have functions. So the leukemia cell doesn't have any function, but it will go and occupy the space in the bone marrow. And I believe you know the areas of which you can see bone marrow. You can get it in the breastbone, the sternum, even the pelvic bone, the femur bone. You understand? That is areas of which you can get even in the this lumbar region, right? The vertebra. So you can get this bone marrow in all these areas. That is where blood is being produced, right? So now when during that production of blood, that when all these things now happen. So that white blood cell that have become a leukemia cell, it will make attempt to kind of grow into good cell, but cannot work, right? In some certain type of leukemia, especially some like we are still going to mention this one, like chronic 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 like that is the chronic aspect, because it actually have a different types. That is acute lymphocytic leukemia, all right? That is chronic myeloid leukemia. Sorry, that was I was trying to say. So now, like in that case, you see there will be a gradual surfacing of the symptoms. So in that kind of a case, you might a kind of not notice the symptoms on time. So let us now take it one after the other, but be prepared to learn one or two things. Let us not take it as if is the um is the sickness of the white people. No, the dark people do not have it. Nigeria do not have it. There is an um should I say what an exercise or which was conducted on some patients that are having leukemia in some states, right? So they have to kind of begin to check the prevalence of this leukemia, to know truly if it's common in Nigeria, especially in some parts of Nigeria. And when they brought the feedback about it, you see that it have deteriorated the health of over 95 patients, you see, of which many of them are adults and few of them were children. So let us take note of this in case you are looking at it as sickness of the elderly people, sickness of those that are outside the country. No, it's right here before you. Leukemia. Yes. Okay, now we are going to take it one after the other. We are going to take it one after the other so that we go through the whole leukemia, that the whole head talk on leukemia, though we're not going to dwell much on any of them, so that we can go and do other things for the day. So if you have any question at all, you can send it in the comment section, or you can private chat me even on Facebook, all right? Anyone, even on WhatsApp, on YouTube here, you can private chat me. You can send me a DM, or you can request my number under the comment section, all right? So I'm very much available to help out in some situation, in many situations, regards to that. All right, let me take a little break. The network is actually warning me that my data is going down, so I will be with you shortly. Within the space of 3 minutes, I'll be back. All right, let me do some data subscription. Thank you.